privilege,
So, good evening. Namaste. Dr. Chauhanji, namaste. And Asim, very nice to see you. And namaste to all the others, Professor Sharma, Dr. Banerjee, and Dr. Sanjana. Very nice to be connected with all of you.
Asim Chauhan is also to welcome you. Dr. Asim Chauhan is also there to welcome you.
Dr. Sangita, we are so happy that you are here today. The whole community is so excited, and we are looking forward to your words of wisdom today.
Your Dr. Chauhan will give all of us the most words of wisdom. All of us should follow in his footsteps, but I'm very privileged. We have a deep regard for your family and a deep respect for your institution. So it's a great privilege to be here today with all of you.
Great.
Thank you so much for these words, Dr. Sangita. Sharmaji, you may want to unmute. Sharmaji, you must be saying something. If you would like to unmute, Sharmaji.
Sorry. How privileged we are to have you, Dr. Reddy, today, this afternoon. We were all waiting for this day to pick up further tips how to remain happy and healthy during the most testing times in which we all are passing through at this moment. And we are very privileged to have our Honorable Founder President, sir, with us, Dr. Sangita Chauhanji, whose blessings and whose visionary guidance in making us all scale unscalable. And we also have our Honorable Chancellor, Dr. Asim Chauhan, with us, who is an inspirational leader and our mentor and guide to take our Amity universities to new heights of attainments and accomplishments and glory, not only just here in India, but abroad. And I have with me my Pro-Vice Chancellor, Dr. Padmakali Banerjee. With me, Sanjana has been in touch with your office regularly in this context, and I have about 500 plus connected right now, and many more will be joining. And the program is live on Amity YouTube. Also, therefore, hundreds and thousands of people would be looking at you for learning today. How do we go about making ourselves so happy and cheerful? Now, with these words, may I formally begin the program with the permission of Honorable Chancellor.
If founder says yes, we can go ahead.
Founder, sir, please.
Yes. Please go ahead.
Asim is looking after this campus where we are having this webinar from the very first day, and he has made as one of the best universities in the country, Amity University, Haryana.
Sharmaji, thank you, founder. Sharmaji, please go ahead. Yes.
Namaskar. Very warm greetings from Amity University, Gurugram. Ladies and gentlemen, what a great privilege and honor to have with us one of the most illustrious daughters of Mother India, Dr. Sangita Reddy ji, the National President of FICCI, the Joint Managing Director of Apollo Hospital Group, to deliver the Amity Eminent webinar address on how to create a positive health environment during COVID-19, and I'm assuming beyond COVID-19 as well. Dr. Sangita Reddy ji, we are so privileged and honored to have you here with us today. A great crusader of good health for all, Dr. Sangita Reddy is a global healthcare influencer, healthcare technocrat, social entrepreneur, and a humanitarian par excellence, passionately committed to transforming healthcare systems for effective healthcare service delivery. She has been conferred with an honorary degree of doctorate by Macquarie University, Australia, in recognition of her resolute commitment to bringing transformative changes in healthcare and championing manifold initiatives, both in India as well as abroad. A firm believer in the potential of leveraging technology in the holistic manner, Dr. Sangita Reddy is focused on setting benchmarks in futuristic healthcare projects, enabling IoT, artificial intelligence, data analytics, drone technologies, and blockchain technology to make our healthcare system highly effective and affordable. A driving force for the e-health initiative. It is under Dr. Sangita Reddy's leadership that Apollo hospitals have received HIMSS Elsevier ICT Achievements Award, and 4 hospitals of Apollo have emerged as Asia's top health cities. We are truly delighted to have you here, Dr. Sangita Reddy ji, with us at today's webinar. Dr. Sangita Reddy, ladies and gentlemen, has been a recipient of numerous prestigious awards for business and leadership. She has been awarded the International Women Entrepreneurship 2019 award for the IWEC Foundation, among other prestigious awards. We feel truly blessed to have the privilege of having you today at the Amity Eminent webinar in the august presence of our Honorable Founder President, Dr. Ashok Chauhan, our Honorable Chancellor, Dr. Asim Chauhan, and a very large number of scientists, technologists, heads of the institutions, members of the faculty, and our highly inspired students of Amity universities in India and many abroad. We are all looking towards you for your words of wisdom to guide us how to remain cheerful, happy, and healthy during the highly testing times in which we all are passing through. Ladies and gentlemen, however, before I invite Dr. Sangita Reddy ji to share her words of wisdom in the Amity Eminent webinar address, may I take this opportunity to invite my high visionary leaders, Honorable Founder President Dr. Ashok Chauhan ji, to share his words of wisdom. We are in Amity universities under the visionary leadership of our founder President, sir. During the last 2 decades, we have made the most outstanding progress in Amity Education Group, which currently stands as one of the tallest and one of the largest education group in the world. We have now 175,000 students in our 10 Amity universities here in India and in 17 campuses abroad that include Amity in London, Singapore, Dubai, Abu Dhabi, New York, San Francisco, Seattle, Netherlands, Mauritius, South Africa, Kenya, and Tashkent, to name a few. I feel highly delighted to mention that under the visionary leadership of our founder president, sir, we pursue research and innovation with a great passion and are focused on integrating education with the advances which we make in our scientific research. I am also happy to mention that Amity University has filed over 1,300 patents of high relevance to our society and nation and have published over 15,000 high impact research papers in journals of high repute, and have set up global consortium in areas of great relevance to advancing the frontiers of scientific research, including one on COVID-19. And our scientists here in India, as well as the ones which are networked globally, are working day and night to see that the advances which we make on the scientific front ultimately benefit the common man, every single man in the society here in India and the vast humanity, so that our efforts are directly translated into the cheers and happiness of the people around the world. With these opening remarks, may I request the Honorable Chancellor of Amity University, Gurugram, Dr. Asim Chauhan ji, to say a few words in the honor of Dr. Sangita Reddy ji, and invite Honorable Founder President also to join you in this endeavor. Dr. Asim Chauhan, sir.
Right, very briefly, I'll welcome, and then founder can give his words of wisdom. But Dr. Sangita Reddy, we are so delighted to have you with us here today, not only because you are talking on a very timely and very important topic about positive health, but also because you represent so many of the traits that we want to inculcate in our Amity students. When our founder, Dr. Chauhan, founded Amity, he said he wanted to create a new generation of leaders for the world who are imbibed with the right values and sanskars, who are innovative, who think globally, and want to help others succeed also. And Dr. Sangita, when I see you, I really feel that you are the perfect embodiment of all of these traits and characteristics that we want Amitians to be. And for all of the thousands and thousands of Amity students that are watching today, not only from the Amity universities in all locations, but so many of our school children and principals and teachers under the leadership of Dr. Amita Chauhan, our mother, who is also online today, as well as our trustees. My brother, Dr. Atul Chauhan, will also be online and will be speaking later, hopefully, as well as so many of the other trustees. They're all online because we see you as a family, Dr. Reddy, who has transformed a sector and a country. Because without proper healthcare, without proper looking after the lives of people, we as a nation cannot thrive. And what your esteemed father have started and what you so ably have taken forward in every respect is so commendable that just having your presence is motivating and inspiring for all of us. As a member of the National Executive Committee of FICCI, I sometimes see you taking the helm as president in a room full of older men and commanding respect and giving direction in a way that only you can do. And I feel so proud to see it. And when I look at my two twin daughters, I hope that they can imbibe some of the leadership abilities and confidence and compassion that you bring in your leadership, Dr. Sangita. So, Dr. Sangita, with these few words, we are delighted, we are grateful to you for giving us your time. We promise you that your presence here will be multiplied in the work that is being done by Amity institutions in India and abroad. And our founder has particular love and affection for your father. And in our family, when we sit together and we talk about great people, very often Dr. Chauhan speaks about Dr. Reddy and his legacy and the person that he is. So this is really not only a talk today, but a connection of two families with love and affection. So thank you for that. And now, Founder President, I would request you to say a few words also, please.
Asimji, you forgot to tell that both your daughters and the sons are born under the patronage of Polo, under the blessings of Dr. Pratap Reddy ji and Sangita ji and others. And Sangita ji, in total, you see my faith and confidence in Apollo from my brother's family, from my family. Suhani Verma has born 11 of my children in your hospital. So this is a great tribute to your hospital. I would say that what Asim told, I totally agree. We all are very excited, thrilled, enthusiastic, motivated, encouraged. Because I tell you one instance, in last few weeks, Sangita ji had to give some very important TV interviews in important channel and long interviews. And when I saw or came to know that she is being interviewed, I left everything else and sat on TV to listen each word. Many times, very, very difficult questions were asked. And I started immediately chanting Gayatri Mantra, God give her the wisdom, but she could tackle every question most eloquently, precisely. So I was so relieved that she's so competent that even the difficult questions of the TV people, she could do it. I think this is at the moment. I'll come again at the end. But Sangita ji, again, my compliment that you came after such busy schedule. We are proud of you.
Ladies and gentlemen, after the words of wisdom from our Honorable Founder President, may I now present to you with all honors our very distinguished speaker of Amity Eminent webinar today, the Honorable National President of FICCI, Dr. Sangita Reddy ji, the Joint Managing Director of very distinguished Apollo Hospital Group, to speak to you on a topic so important, how to create a positive health environment during COVID-19 and beyond. Over to you, Dr. Sangita Reddy ji. We would hear you with tremendous amount of interest and enthusiasm, and to pick up from you the very best tips, which will be very valuable to all of us. Madam, please.
Ma'am, you are muted.
Okay. Dr. Ashok Chauhan, the founder and inspirational leader of Amity University, who has created a revolution in education and a lighthouse where many others continue to learn the power and the magic of being inspired by education and contributing to nation building through education. Dr. Asim Chauhan, you follow very ably in the footsteps and the traditions of your honorable family. All other family members, especially any members of the Apollo babies from the Chauhan family, and Professor Sharma, Dr. Padma Kali, many others of the foundation. Namaskar and good evening. It's a privilege for me to address over 1,000 brilliant minds, fine young individuals who will create my tomorrow, and also the esteemed faculty of Amity who are shaping those minds. And talking of minds, I can only remember a quote, which is that A mind is a powerful force. And this mind can enslave us or it can empower us, as it has empowered all of you. It can plunge us into the depths of misery, or the same mind can take us to the heights of ecstasy. And the important and the most relevant thing which all of you are doing today is learning how to use the power of your mind wisely by filling it with the right knowledge, the right path, the right skills, the right capability. And today, as humanity is grappling with a never seen before generational medical crisis, which is now becoming an economic crisis and therefore a social crisis. There are geopolitical shifts, there is global friction, there is the manifestation of a burgeoning crisis all over the world, and there is also a sense of pervasive fear and anxiety. These are difficult times for all of us. And when we hear about the spread of COVID-19 from all over the world, whether it's television, social media, newspaper, friends and family, from the sabjiwala to the driver, everybody is worried about COVID. And today, as our country crosses this, over 6,90,000, we'll soon be crossing 7 lakhs. We are indeed, significantly concerned about what is happening. But as was said, that you can only see the brightness of the stars in the dark of the night. And it is in this dark of night that we see some of the fantastic things which are happening in our country. The fact, or even across the world, that we are collaborating, we are using our pharmaceutical prowess to share medicines with the world. We as a country could produce less than 10,000 PPEs per day prior, just 6 months, 5 months ago. Today, the country is producing over 4 lakh PPEs per day. This is the capability that the human mind and the intellect has to work together. Another very important point is, despite the fact that the number of cases is so high and over 7 lakhs, as a percentage of population, this is not a large number, but more significantly is that the death rates have stayed below 3%. And now in institutions like Apollo, we are seeing our death rate is currently under 1%. And therefore, the primary message that I want to give all of you is to have courage, to have faith in the capability of the human spirit to overcome even something as dreadful as COVID, and to explore within the realms of our mind and our knowledge how we can attack this virus, how we can overcome this virus, and use this time and this situation to draw upon new skills and new capabilities that we've never had before. First, I think it's important to accept that whatever we're feeling, it's okay to talk about it. There's no shame in being afraid. Yesterday, I was at a function where one of the ministers, very powerful minister, had COVID and got admitted with us. And he said there openly in the meeting with all police people, everybody there. It was a plasma donation camp. And he said, I was very, very scared. But I went to Apollo, I was treated, God's grace, everything was fine. But the first point is that there is no shame in being afraid, but it is in overcoming that fear, in helping others. And the most shining example of people overcoming that fear, in my mind, is the nurses. Nurses all over the country, small little girls from, whatever is their background, they wear the PPE, they know they're putting themselves at risk, but they're doing it for the sake of humanity. And that, I think, is one of the most shining examples we have, that the medical profession is going into the wards, knowing that they're at risk. No family members, no wife, no brother, no mother is allowed inside. But these are there taking care as if it's their own family member and overcoming that fear. Next is that I think social isolation itself is very hard. By nature, people or human race is a very social race. We like to meet each other. And today we're finding technology to find ways for us to meet. And the restrictions which were imposed by lockdowns were not easy. But people learned virtual meetings, work from home, multiple societal shifts of study from home. All these were necessary. And so we must learn to create the bonds and the relationships Today, I feel as close to the Chauhan family as if we were sharing dinner at a table. And it is for us now to find ways to build upon our earlier relationships, yet also make new relationships in the spirit of humanity and connection. And respect these lockdowns and these isolations, because this is what we're doing, not just for our sakes, because maybe you don't mind, you're 23 years old, even if you get sick, you're going to recover, it doesn't matter. You're doing this so that you don't come into contact with another friend who may be living with his grandparents in the house. And that 85-year-old or that 90-year-old grandfather having COVID may rob him of his life itself. Because all of us know, while we're all facing the same storm, we are not in the same boat. We are not in the same boat medically, because whether it's age or other comorbidities like diabetes, cancer, immunosuppression, those people are more susceptible for COVID. We're not in the same boat in terms of the same socioeconomic, because many of us who are staying at home, many of all of you, have nothing to worry about in terms of you have food to eat, you figured out ways, whether you're learning how to cook or there's Swiggy coming home or your parents are doing this. But there are many for who this situation has even robbed them of livelihoods. So this is a time for us to appreciate what we have and to understand the difficulties of society at large. Coming back to the mind is really a window to your body and to your soul. And it's crucial that it receives the proper nourishment, as your mental health actually determines how your body functions. Many of us know how stress has affected various disease conditions, whether it's amplified your blood pressure and therefore brought forward your cardiac problems. So it is very important for us in this time to have the resilience, especially the emotional resilience, and the willingness to convert this crisis into an opportunity. COVIDs are times of tests of leadership. And that leadership is not just large leaders of institutions like Dr. Chauhan and Dr. Aseem and Professor Sharma, but it's also the way we decide to lead our own lives, because each one of us is a leader of our own life. And this is a defining moment for all of you to understand and appreciate how you will lead your life. It is indeed a time where across the country, the spirit of entrepreneurship is blooming. And some of you, while you know my Apollo background, are also seeing a FICCI background. And so as we're talking about the economy to different ministers, about businesses to different business leaders, I've been witnessing for the last 6 months that an underlying positivity and a willingness to find solutions and not bemoan the situation is what's separating the leaders from those who will just survive. And this is a point of time where the best of innovations must come into play. Whether you're using the digital technology or you're using Indian jugaad, you're finding ways to reach out. I've been with school and college students who have found ways to use mobile apps so that they can gather food and feed those who don't have. I've been talking to scientists who are finding ways to accelerate the data points so that they can contribute in vaccine delivery. And I'll share with you a little later what we have done at Apollo in terms of response to the disease and to the virus. And this pandemic, which is, it started as an epidemic. It became a pandemic. It will become endemic to the entire population. And it's for us to decipher how we learn to live with this scenario. We all heard wear the mask, sanitize your hands, keep social distancing. And in addition to that, we must evolve and figure out how we can contribute towards the overall economy. Whether it's the auto manufacturers who have started producing low-cost ventilators, or small household and housewives who have started producing masks so that the country actually has no shortage of masks. And as of 3 weeks ago, we opened up to say that masks and PPEs which are produced in India can now be exported to the world. Some people are doing do-it-yourself baking kits. Some people are going onto Instagram and figuring out how to help somebody else have a haircut at home. There are cleaning services which have come in. So businesses are beginning. an enterprising mindset, and a willingness to think fresh of what this situation begins is truly one of the most inspiring things to have in these challenging times. But most importantly, in acknowledgement of the fact that everybody is suffering, this is a time to find a way to serve humanity. And like Mahatma Gandhi said, the best way to find yourself is really to lose yourself. Lose yourself in the service of others. And his words come alive every day, not only as you witness the corona warriors who are fighting the virus alongside patients, but I see it really in the police force who have been forced to celebrate their birthday, their family's birthday, or a festival on the streets. You see it in the sanitation workers who are putting themselves at risk, but finding ways to collect the garbage and keep our streets clean. And beyond saluting these frontline warriors like doctors, nurses, paramedics, police, and sanitation staff, all the government agencies, all the essential services who have been doing so much during this time of pandemic, we must learn from them about the joy of losing ourselves in the service of others. So whatever it is that we can do to help others during this time, it will be truly, truly appreciated. And on account of the pandemic, India saw the largest migration that it has ever seen in recent times. And we saw sad images of these migrant workers on television. But how many of us stood up and said, I want to do something for them? I will reskill 5 people so that they will get a job. I will feed 200 people so that their families won't go hungry. It is this spirit that we must always keep in ourselves, because we never know how the collective force of humanity can transform society. As students of business, you must bear in mind that caring for the community is truly an integral part of that business. Because unless that individual has a buying capacity, the overall GDP of this country will disappear. And your model must be an inclusive model, so that this sense of gap or the digital divide or the missing middle or the people left behind, we will find a way to be inclusive and take them. And as C.K. Prahlad most powerfully said, there is also business in that, whether it is in Dharavi or business at the bottom of the pyramid. I remember how powerfully he said that if our dream is that every Indian child must eat an ice cream, we will find a way to manufacture ice cream at 5 rupees and not 30 rupees like Baskin Robbins. And to do that, we will re-engineer the cold chain. We will relook at the supply. We will relook at the production cost, but we will find a way to do that. So find a dream, find a way that you will transform your world, and your life will be so worth living in many, many dimensions. To this, one of the biggest examples for me is really my father, Dr. Reddy, the chairman of Apollo. He gave up a very successful practice, and at the age of 50, he started a new enterprise. So all of you who are young with a whole new career ahead of you, imagine someone who's 50 years old, giving up what they know and saying, I will start a world-class hospital. And he needed to re-engineer the way hospitals were funded, were designed. There was no architect for hospital. The way hospitals were managed, there was no course in hospital administration like all of you have in your college. And to find ways to do that in a world-class manner. But by doing so, he enabled us to give to the world and to the country over 10,000 beds and the ability to treat over 18 million patients, and to continue to do so in a manner which is a lighthouse to other hospitals, because the benchmarks of excellence and the spirit of caring for humanity are at the center of everything that we commit to do. And in that spirit, when COVID hit, many people said, please don't take COVID patients because your whole business will go away. And finally, in our leadership meeting, when we realized the enormity of it, we very simply said, our people need us. It's the right thing to do. So we will find a way to do it. So we created this concept of Apollo Kavach, where the patients who needed care would be treated like an infectious disease environment, which would be separated from those who are our routine patients, because emergency, cardiac patients, chemotherapy, dialysis, that has to continue 24/7. Yet we have to live up to this challenge. We said we would use technology. So not just putting up a 24/7 call center, we amplified our app and created an AI-enabled risk score for COVID, where over 18 million people have taken that risk score in this self-assessment scan. We converted our doctors to a 24/7 consultation capability. And today we used to do about 200, 300, 400 teleconsults. Today we're doing over 5,000 teleconsults a day. 3,800 pharmacies were all supplied with adequate staff and the supply chain to keep working. And then many more. We spoke with international experts to decipher the right treatment protocol. Whether it was remdesivir, the steroid, tocilizumab, plasma therapy, oxygen therapy, prone therapy, each one of these in the appropriate protocol at the right stage, so that we could give every patient the kind of care that they required, but also the innovation. How did the engineering team create negative pressure rooms out of simple rooms so that we didn't spread the virus? How did they bring telemedicine into each room with a simple telephone connected into a central station so that the patient could speak to the nurse, because you couldn't always keep running into the room? Virtual dietary consults, virtual rehab consults, virtual post-COVID rehab programs, all these have been incorporated. And then we did other innovations like the hotel. We knew we would not have enough rooms. We converted over 2,000 hotel rooms into isolation rooms using telemedicine so that people could stay, because in many Indian homes, 5 people stay in a room with 1 bathroom. How will they isolate themselves? So we gave this service, and thankfully with the help of donors, we got money from Deutsche Bank, RBI, SBI, and others, so that we could give this service free of cost to those who could not afford it. And our Red Book, which is really the treatment guidelines, not only did we use it in our own 2,000 inpatient beds, which was separate for COVID, but we shared it with nursing homes and hospitals. And our rough estimate is that over 70,000 beds followed the Apollo Red Book guideline in terms of treatment. Today, we are into our 24th version of that upgradation of clinical protocols and manuals, taking PubMed, looking at over thousands of papers, talking to international experts to figure out what is the best way to treat. I can go on sharing Apollo COVID diaries, but I'm very keen to hear your questions and to understand what you would like to hear about. So let me conclude by saying that a combination of a healthy body and a healthy mind, with the spirit to serve and be part of the community, with an overlay of innovation and a mindset of digital awareness, together with the ability to not just face the stresses of life, but to appreciate some of the beauties of life. Whether you found time to read a book or learn yoga or have dinner with your family or to listen to music, the combination of these creates 360-degree holistic individuals, which I'm sure all of you are shaping up to be. And so in this, may your bucket of joy be full. May you find ways to make your lives meaningful. And remember that in a few decades from now, when you sit down to talk to your grandchildren, they will ask you, what did you do during COVID? So remember that you have to use this time meaningfully and have something powerful to commit and share, as many of the esteemed people like Dr. Chauhan, Dr. Aseem, Professor Sharma, and many of you have. So stay committed to building a beautiful tomorrow, because you youngsters, you are what we are banking on. You are our hope, you are our future, and a strong India, a powerful India, a $5 trillion economy, an Atmanirbhar India, and an India which takes its rightful place on the global stage, can happen only by the power of our youth. And we salute you. And I'm very, very happy and thank Amity University for giving me this chance to interact with all of you. Namaste.
Wonderful, wonderful. Great.
Madam Dr. Reddy, We are truly thankful to you. Really speaking, I can say this with conviction that this is the most powerful, positive, and inspirational lecture I have ever heard in my 51 years of professional life. And I'm pretty sure everybody listening to you today would be filled with tremendous amount of hope for creating a better world than the world we have inherited or left behind when COVID started. Your positive tips on leadership, your positive tips on utilizing our power of mind for creating cheers and smiles for us and empowering ourselves with abundance of creativity and positivity will be well taken by the youth of our country and abroad who are listening to you. Each one of you, I'm sure, must be highly excited after hearing to you, and so is my founder president, sir. I would like founder president, sir, to say a few words before I take up some few questions from the youngsters. There are very many questions with me which have already come in. Founder President, sir.
Dr. P. V. Sharma, I'll come later, but at the moment you can welcome our soldier of Pratap Reddy ji. Dr. Anupam Sibal has already joined. You can just welcome him.
Yes, I can see Dr. Anupam Sibal being with us this afternoon for this very important webinar. Dr. Anupam Sibal, the Group Medical Director of Apollo Hospitals Group and President, Global Association of Physicians of Indian origin, who has written the bestseller book, Is Your Child Ready to Face the World, is with us. A warm welcome to you, Dr. Anupam Sibal, for sparing your valuable time. We are so delighted to have you here. Dr. Reddy, very many questions are with me at this moment, and youngsters are especially more concerned than me. I am cheerful as ever, and one has to be in the seat of the Vice Chancellor. You can't be miserable while signing the degrees or giving sermons on the Mount. But the youngsters are asking me, in fact, asking you through me, how they can remain cheerful, happy, and positive when they have so much of stresses generated due to online classes during the day and several other online commitments which they load on them for online training and online consultation, including their connectivity to very many social groups. How can they remain so cheerful, happy, and healthy under these stressful environment? This question is asked by Vanishka, MSc Forensic Science, third semester from Amity School of Applied Psychology.
So Manishka, good evening. The very fact that you're taking forensic science shows your powerful intellectual capability and your analytical ability. So let me share with you something that, my father once said. Working in a hospital can be very stressful. You have the patient, the trauma, the sadness going on. You have the deep intellectual knowledge of your doctors, and each one of them sometimes, a diagnosis may or may not be available. And then you have the technology, whether, the CT scan. So it's a very complex, very demanding science. And one day I was really stressed. And he very basically told me two things. He said, number one, God never gives you a challenge that you cannot handle. And number two, the most intelligent of human beings uses less than 9% of the human brain. The capacity of the human brain is unforeseen, untapped, or tapped to a very small degree. So it's very important for us to feel that intrinsic capability. And then you use all the other routine tools, whether it's, managing your time, creating a checklist, putting out an effective timeline or a calendar, understanding how you can segment your thought process, refreshing your mind, whether you're doing yoga or meditation or listening to music, refreshing your mind, and also having a healthy and a very balanced diet. I must share with you that it is a sad fact that 40% of Indian women of all socioeconomic classes are undernourished. They have enough calories very often, but they don't have the right nutrients, and 40% of them have anemia. So keep yourself healthy, because the physical health will also help you handle all the challenges that you have to face.
Very, very important, rightly said. So I think the message is loud and clear. Despite being busy in studies and several other pursuits, spare some time for yourself. And surely eat healthy food and pray and do some meditation, even do some japam of Hare Krishna or whatever mantra you decide to recite. There's another question from a young student, Divya Mittal, studying Master of Public Health from Amity University, who asked how to deal with stresses when you are in self-quarantine situation, maintaining a positive environment around you. When you are in self-quarantine and isolated, how do you maintain cheerful face and positivity despite the fact that you are isolated and you are told not to come out at all? There are some in my university also. I quarantine them for 14 days. So how do they remain cheerful?
So, you know that there are two ways to handle your quarantine. Treat the quarantine like a self-imposed vipassana and truly use it to refresh your internal capability, whether it's your mind, your meditation, your body. The other thing is to really realize the fact that nobody in this world today is quarantined. You are connected via your phone, via the digital media. You can study, you can watch a movie, you can listen to music, you can talk to your friends. So where is the quarantine? Physical is only one dimension of who we are. If that physical dimension is temporarily suspended, it is no reason to be in any kind of depression. The second aspect is that if you for a moment forget about yourself and say, I am quarantined so that I do not spread this. The whole world is fighting a war against an invisible enemy, a war where no bullets are being fired, but the virus is contagious and potentially devastating. And I am helping to fight that war by keeping myself away from others, because this war makes a human being as a host to the transmission of the virus. So you are playing a role in fighting the war and winning the war for humanity. Put in that perspective, is 14 days of isolation difficult? I don't think so.
Rightly said so, Dr. Reddy, you are absolutely right. We could utilize this time to be more introvert, learn a lot beyond what we would have otherwise done, and discover ourselves much better, and remain cheerful, happy, and healthy for a better day, as will follow from the 14 days quarantine. Yet another question I have, and then the last one from my side, and Dr. Sanjana will take over from me now for other questions. Dr. Madhuparna Chakravarti of MBA in Hospital and Healthcare Management at our university is asking, with massive disruption of the kind which we have seen in our economic and business activity, you also made a mention that the daily wage earners have found it very difficult to cope up with this situation. How do they remain cheerful, happy, and with positivity during these times when they have hardly anything to eat? You said that we must take care of the last person in the society.
Absolutely.
So that no one is left behind. How do these poor people who have really suffered so badly keep themselves in the positive environment?
So may I first take a minute to say namaste to Mrs. Chauhan. Thank you so much for joining. It's a pleasure to see you. And sir, I think that it is devastating what has happened to so many families. But the fact is that I must acknowledge that the government of India did work on the free distribution of pulses and grains. So I would actually say that while some may have gone to bed hungry one day, nobody has, either died from starvation or been disrupted in a manner that affected, their life. And indeed, lives have been saved and protected. How can be kept cheerful? I think there's a lot of role for us to play, is that we have to communicate that the jobs will come back, build institutions that continue to employ people, find ways to reskill and retrain, whether we're doing this online, so that they can get back into a job and a livelihood. We must innovate and find ways to do so. I'm also seeing on your question box, so with your permission, I'm going to take this question from Sudhanshu Tripathi.
Hey, please.
And he says, what kind of technical equipment Apollo is looking at, and what type of problems faced by staff under this pandemic, where our engineering graduates can come forward with solutions? So I'm so happy to see this, Sudhanshu, because biomedical engineering is one of the most important sciences that we need to evolve. The fact is, in India, a lot of the cost of healthcare is contributed by the high cost of technology and the high cost of consumables. So if your engineering institute can partner with our hospitals and figure out how we create India-based solutions, the fact is that in today's world, many of the high-end technologies are all based on a sensor. If we can combine that sensor with the CPU and reprogram and use the computing capacity with multiple sensors, for a nursing home, they don't need to buy separately an ECG machine, a PAP flow meter, EEG machine. Instead of buying 6 machines, the same CPU could be connected to multiple peripheral devices. And this machine could bring this type of high-end care and technology into rural India. We also worked on some levels of innovation, estimating a ventilator shortage. We worked with the defense labs and did 3D printing so that we could do split ventilator. We worked on helping build new ventilators in India so that what currently costs 30 lakhs and was unavailable is today being manufactured in India for 5 to 7 lakhs. We validated ventilator equipment. So we're very happy to look at other areas. And in fact, I'll share with you, my husband, who's a biomedical engineer, had moved into real estate and politics. He reactivated his engineering team during this time. And he has built what is called a PAPR, which is a powered air purifying system. So I have flown to Delhi, Chennai, everywhere fearlessly because I'm carrying my own power supply, which is filtered by the N95 and is blowing in fresh air. And this is now being used by our nurses and doctors in addition to the PPE. So because the mask sometimes suffocates them. We've had nurses who have actually fainted by hypoxia. So there's a lot to be done in terms of innovation. And I would encourage you to explore the area of biomedical engineering.
We would surely do it. We have a very strong ecosystem of innovation in our university in Amity, and we find that the younger minds are highly innovative and creative.
Absolutely.
Our biomedical students here in Amity University, Gurugram, as well as in other Amity universities, would be too delighted really to work on products which could be of direct value and benefit to improving our healthcare and making it more affordable. At this point, may I invite Dr. Sanjana Vish to carry forward a few other questions which you have with you, Dr. Sanjana?
Yes, sir. Thank you, sir. First of all, I would like to thank you, Dr. Sangita Reddy, for her enlightenment talk and her enrichment tips which she has given today. It is a need of an hour, and I'm definitely sure that these tips are going to benefit to each and everyone whosoever is listening today. So there are so many questions. The next questions which has come here from Zenith Banzami, who is a student of MBA with specialization in hospital and healthcare management. She is asking that we often watch in news that technology is being used in various forms in healthcare. So I wanted to ask that all that is shown is right. What is the penetration percentage of technology and what are the constraints we are facing right now in healthcare?
So, the question that you are asking is something which would take another 1 hour, but it's a deep and a very good question. So thank you for that. I think that at a very, significant level, technology has transformed the way we look at healthcare. And I say the 3 B's have transformed healthcare. The first B is biology. The day that the genome was deciphered and we understood that certain combinations of the genome cause certain representation of disease, we may wonder, there's a certain person who eats all the, chicken butter masala, he has everything, he smokes, he drinks, but he doesn't get a heart attack. And the vegetarian uncle who's living next door, he got the heart attack. So a lot of that is premedicated on the genetic makeup of an individual who makes him susceptible to a disease pattern. So the first technology which is used to transform healthcare is genetic profile. And you mark my words, in the next 5 to 10 years, everybody would have a genotype phenotype analysis so that people at high risk for a certain disease would be proactively taken and treated for them, so that they do not get you won't get a heart attack, you won't get a stroke, because this would have proactively been treated earlier. The second B is bytes. The bytes, or the computing capacity. By Moore's law, all of us know that the compute capacity is doubling every year. This is enabling us to have more and more powerful imaging. When we started Apollo in 1983, we brought the country's first CT scan, which is a 16-slice CT scan. Day before yesterday, in the middle of lockdown, we installed 1,674 slice CT. So look at the transformation which is happening in computing capacity, and therefore imaging, and therefore our ability to decipher. Now you're merging images, you're merging databases, you're fine-tuning and looking on research and patterns of what is going to happen. So bytes is the second, and the third one is bandwidth, because the knowledge of a doctor sitting in Delhi can go to the smallest town in Bihar, to an unconnected village in Kanyakumari, and we can share this expertise via telemedicine. So biology, bytes, and bandwidth are the 3 Bs which are transforming healthcare.
We are so happy, really speaking. There are a lot of questions from students, but also there is a burning question from one of our head of the institution who is heading the stem cell research at our university.
Yes.
He's asking us what would be the long-term effect of COVID-19, both on the human health as well as on psychological health actually of the people. What would be the long-term impact actually of COVID-19? We may get
this is a fantastic question, Professor Sharma, because first I'll focus on what we're seeing in terms of the immediate term of the delayed recovery. So we're seeing a higher incidence of heart disease. We saw a patient who we discharged very well after being treated from COVID, came back 2 weeks later with a heart attack. The blood clotting is having implications even in terms of strokes and other cardiovascular, so all vascular disease. You're seeing implications in neurological, so the ability to recover, repeated headaches, incidence of forgetfulness. So this is a very new disease, and scientifically we are still studying it. From an implication on mental health, the fact of this period of isolation, depression, deprivation, change in habits, the only thing I can hope is that we have built the resilience to handle this problem so that it does not have too much long-term effects on the mental health of individuals and, a generation of youngsters who we want them to be fighting fit to face the rest of the world. So I would focus on the mental health of all generations, but especially on the middle and the youngsters, so that they recover from this. And with that, we have a young individual who has joined us, Dr. Atul Chauhan. Very happy to see you online, and thank you for joining as well.
A very warm welcome to our Honorable Chancellor of Amity University, Noida, for sparing his very valuable time. Dr. Sim Chauhan, Honorable Chancellor, is here. We are so delighted to have you, sir, and would like to have your words.
Yes. No, Dr. Sangita, I think there is no way that everyone from the family will not be online to listen to you. What an inspirational talk you had for the thousands of Amity students and faculty members who are online. And as you rightly said, our families have decades and decades of very close relationships, starting with Dr. Pratap Reddy and Dr. Ashok Chauhan. And I think what always binds together people or families is if you have the same thought process. And I think what we have seen with your family, the passion that you have to do good for humanity, the humbleness that everyone in the family has, is something which resonates with the values that have been taught in our family since many generations. And we have so proudly as a family seen your leadership how you have built up the group over the last many decades. And that's why we are especially proud that you have taken out time today to speak to so many of our Amitians. And as you rightly said right in the beginning, our world at the moment is facing two major crises. One is health, and the second one is the economic crisis. And as we can see, even with the backdrop behind you, you are in the leadership position in both. As the joint MD of Apollo, I would say the leading medical group of our country, and also as the president of FICCI, representing the whole of the industry. The responsibility you have at this point of time, I would feel very, very few people in our country have. And we are so proud that such a person like you is taking on the responsibility for the industry and for the medical field. And I think we all heard you speak about the initiatives that you have taken under your leadership through Apollo Kavach. And it's really amazing that how much care you have taken to the minutest detail to take care of patients. I think in these times, I mean, of course, everyone knew the value of the medical field, medical professionals. But at this time, when people have stood on rooftops and they have clapped and saluted for the healthcare workers, it has become even more clear that how much sacrifice our doctors and our nurses on a daily basis do for other people who are not their own family. And I think that is something that you have brought out, that youngsters need to have this compassion. You have told to people who will become business leaders, even if you become successful, you have to value the lives of others. So we are extremely proud and so happy that you have given these words of wisdom. And together with all, I welcome to you and thanks to you. Thank you.
Thank you so much, Honorable Chancellor, sir. Your words of advice and wisdom are very valuable to each one of us listening to this very important webinar, directly guiding us how to remain cheerful and happy. I have one last question from me, Dr. Reddy. This is from Dr. Ranjana Bhatia of Amity University.
Dr. P.V. Sharma?
Sir.
Before the next question, can you please introduce our Dr. Madhusudan Chaudhary, from a senior consultant from Apollo. He has joined, Dr. Madhusudan Chaudhary.
What a pleasure. What a pleasure to have Dr. Madhusudan Chaudhary ji, sir, sparing his highly valuable time, joining us at this very important webinar. A very warm welcome to you, Dr. Chaudhary. We are so delighted for sparing your valuable time. The question being asked by Dr. Ranjana Bhatia.
Professor Sharma, can I ask this question? Because this question is from my mentor and my guide, Dr. Ranjana Bhatia, and I would like to ask this question.
Please go ahead.
Sir, can I, sir?
Yeah, please.
Yeah, thanks a lot, sir. This question is from Ranjana Bhatia, who is currently head of the Department of Psychology and Psychology at Amity University, Noida. And she believes in power and blessings so much that her question is also related to that today. Power and blessings of God are supreme in facing and challenging any adversity. What is your opinion about the power of prayer when one faces adversity and challenges in life?
So it's a deep and truly significant question. And I actually wanted to end my session today by thanking Dr. Chauhan, because when he said that I prayed Gayatri Mantra that you could answer those questions, you know, there is a power to be able to, so there are, I think, multiple powers in this. The first power is that when we reach out to humanity, he prayed not for himself. He prayed for me, not knowing whether I did not know he was praying. I did not see him praying, and yet he prayed. And it is in that kind of prayer that you forget yourself and become one with humanity. And I think that itself is the biggest enabling power for a human being. That if you can put yourself as one with humanity, and that is indeed what has been taught in our culture, which is Vasudeva Kutumbakam, that we rise ourselves to say it's not just me, it is the whole world or the whole of humanity. The second thing I would say is that when we can think about the fact that everything I do in today's world, I mean, our children are so intelligent, so skilled, so capable, so IT savvy, they do 100 things. And yet, one of the biggest things is the appreciation of the fact that we can work on our efforts, but we do not control our outcome, which is from the Gita, and I wish I knew enough Sanskrit to quote it. But that power gives us the ultimate aspect of laying down our efforts and saying, I've done these efforts, please bless them. Because the outcome of that is not in our hands. And that ability to appreciate that there is another power, whether that power is coming from another human being, from God himself, internally from ourselves, we do not know. We have not seen God, but we feel the power of God. And an acknowledgement, and that's, this is what during this lockdown, we had time to spend with our own children also, not as much time as I would have liked because we were very busy at the hospital. But my son, who's studying medicine in UK, was with us at home for 5 months. And he asked me, Mom, why do you go to the puja room every day? What is there in those pictures? And I told him that actually, maybe there's nothing in those pictures, or there is so much in those pictures. It is what we create out of it, because God is indeed everywhere. But the bigger point is that we create this focus to say that there is an additional power. Please let me channelize that power for the power of humanity, for the benefit of humanity. And it is in that acknowledgement and that realization and that surrender that we get empowered. So that is, my kind of simple take on a very deep subject.
Absolutely right. The power of prayers becomes infinite the minute you pray for others.
Absolutely.
Surely it will work wonders when you pray for yourself as well.
Right.
I'm pretty sure the power of prayer is already integrated in Apollo hospitals. They have a prayer room, and I visited once to test the power of prayers myself when I was visiting one of my very near relative who was in ICU. My call was answered, although the time of visiting hours were over, but my prayers really worked wonders. Somebody came from inside and said, Vice Chancellor, sir, you can go inside. Your prayers have been answered. Well, that may be a coincidence, but I have with me the head of my psychology, the supreme psychologist, Dr.
P.V. Sharma, Dr. P.V. Sharma,
my Vice Chancellor.
Dr. P.V. Sharma,
Sir.
Just I have Dr. Anupam Sibal is here.
Yes,
he has been telling me in all meetings about the great vision, foresighted and concepts from Sangita ji. Dr. Anupam Sibal, I will not be able to articulate it what you have been always telling. Can you in few sentences tell yourself what extraordinary visionary approach you have been telling about Sangita ji? Dr. Anupam Sibal.
Thank you, Dr. Chauhan, Amita ji, and distinguished members of the Amity family and the Chauhan family. It's indeed a privilege to be a part of this discussion. I'm sorry I have another meeting to go to, so I'm actually in the car. But I mean, what can I say about Miss Sangita? She's an absolutely extraordinary leader. She's very innovative, and I think if I were to highlight to everyone that the Prime Minister on the 15th of August in his address from the Red Fort talked about the national digital mission that we have in terms of everyone getting digitalized health records. That is something that Miss Sangita has tirelessly worked for more than 2 decades. In fact, she was instrumental in initiating electronic health records into Indian healthcare, and has worked over the years in terms of explaining to all the government officials the power of IT and how IT can actually make such a huge difference in healthcare delivery. And she's worked over the years in terms of the last mile delivery. If some of the programs that we look at in terms of the EUHC that we have in Andhra Pradesh, the e-ophthalmology program that we have in Andhra Pradesh, e-Aushadhi in Jharkhand, the telemedicine program in the Himalayas at 12,000 feet, the radiology program in Uttar Pradesh, and of course the eICU concept, and now Apollo 24/7. So the achievements of Miss Sangita in healthcare have been huge. Of course, she has been leading the Apollo group and the expansion, ensuring clinical excellence, ensuring quality research, academics, focusing on HR. But I think at the national level, the contribution is immense. And thank you so much, Dr. Chauhan, for allowing me to say this.
We are truly proud of you, Dr. Reddy, the contributions you are making to improving the life of every single citizen of this country. And this
No, I appreciate that, but anything we do is only because doctors like Anupam, Dr. Padmakali Banerjee and others, it is their great work that we get to reflect or assist. That's about it. But thank you so much.
Dr. P.V. Sharma, we have with us Dr. Madhusudan Chaudhary.
Sir.
Excuse me, the other doctors, but I always say he's the best doctor in the world. Dozens of my people from Amity are admitted to Apollo whenever they are somewhere else. I love everybody from my employees. I tell them I can only save your life if you come to Apollo under the patronage of Dr. Reddy's people. And just recently, one day, my mother-in-law got some problem in health, and 4 hours in the night, Dr. Chaudhary was struggling. At 3 a.m., he tells we should immediately rush her to ICU Apollo. She was rushed to ICU Apollo, and few hours, she got a cardiac arrest. And Dr. Chaudhary just came back, he rushed, and it is only Apollo in the whole world where my mother-in-law could have been saved. So, and he's treating all my people because he's a internal medicine people, but he knows. I thank Sangita ji that your house has given patronage and motivation to such doctors. Even in Germany, I never allowed any doctor to give any medicine without asking Dr. Madhusudan Chaudhary. He is staying in the residential campus where I'm staying. In 30 seconds, he jumps to my house. Thank you, Madhusudan ji. Madhusudan ji, one word from you.
Yeah, very proud of you, Dr. Chaudhary, and each one of us truly looks at you, and I often get your advice through Honorable Founder President Sir and my Chancellor. When I had my problem in the leg, your advice came right in time to make me happy and healthy once again. Sir, a few words from you, Dr. Chaudhary. Just unmute.
You are muted, sir. Sir, please unmute yourself, sir.
Just
Dr.
unmute.
Chaudhary, you have to unmute.
Please.
Good evening, everybody. I'm still telling the Apollo Hospital, you come at this time of Apollo Hospital and you will find the difference between the other hospital and the Apollo Hospital. We have absolutely safe place. Anybody can come here. Don't worry about the COVID and other things because we have absolutely isolated the COVID, and the mother-in-law of Dr. Chauhan was admitted, and we got her RT-PCR also done after 10 days of the hospitalization, and not only for her and all the accompanied who came here with this, and all were negative. So I am telling you the Apollo is absolutely safe. Don't worry all these things, and we are taking care of everything, whatever is required there for the persons as well as for the patients.
Sangita ji, my compliment for you, for your hospital. Compliment, appreciation. Thank you.
Before we come to an end, last question from Dr. Padmakali Banerjee, if you have any, Dr. Padmakali.
Yeah, very good afternoon. First of all, I think when I was hearing Dr. Sangita Reddy this afternoon, and I must tell you that not only you're an eminent leader, but you have been a healer. The way I think the entire audience connected with you was not only the words of wisdom, which you mentioned in terms of how a great leader has to be a great visionary, like we have in our founder president, Dr. Ashok Chauhan, and also from our chancellor. But you also mentioned about like how one can utilize and be mindful. So I do not really have a question at this point because you have given great answers, but I would wish that, you know, one message that you would like to give to our youth, that we'll put it up at the Amity University and set it up, because we have large numbers of centers of excellence at the university. And definitely a message from you that we can put it up, which would be great for us. So possibly if you can share your message. And also, I must tell you that our founder president, Dr. Chauhan, the other day reminded me of the book that I had published 2 years back, which is published by Sage on power of positivity, optimism, and the 7 sense. So where I've given the concept of 7 sense as your optimistic intelligence. And today you spoke really of resilience. So I think somewhere, all that is echoing, and it is a great platform for all of us. We could hear our chancellors, we could listen to your great doctors who have healed so many people. And we are looking at a lot of our students who are possibly going to do some patents and possibly work together with great institutions like, Apollo and Amity together.
Great. I think now Sangita ji wants to go. I think we should leave her. She has some other appointment. Thank you very much, Dr. P.V. Sharma. Now let Sangita ji go because she's under very time pressure.
Just to close this very important Eminent webinar, let me thank Dr. Sangita ji from the core of my heart on behalf of the entire Amity Education Group for sparing such a valuable time with us. Your message is loud and clear, and if you permit just half a second, I can recite this for you. Your message is very clear that this is the defining moment for each one of us to decide how we want to live our life and lead our life. This message is loud and clear for each one of us, whether we are in chair of authority or otherwise. Your message to youth is also very clear that mind is the most powerful force which they have with them, and therefore they must make use of this, ensuring that tremendous amount of positivity is cultivated in mind to cope up with the current pandemic situation and hereafter also to remain cheerful and excited. With these words, ladies and gentlemen, may I once again thank our very, very distinguished speaker of the day, Dr. Sangita Reddy ji. I also thank our own founder president, the visionary leader, our own mentor, Honorable Dr. Ashok Chauhan ji, our honorable and respected Dr. Amita Chauhan ji, the Madam Chairperson, Honorable Chancellor, Amity University, Uttar Pradesh, Dr. Atul Chauhan ji, my own Chancellor, Dr. Sim Chauhan ji, and each one of us who are connected to this very important webinar. Madam, thank you very much indeed. Not only we will cope up with the present wave of uncertainty and fear which we have around, but would also prepare ourselves to face the challenges of tomorrow with tremendous amount of courage, conviction, and with positivity with which the human beings are to be empowered with. We thank you so much for giving us this privilege and honor to be in your company for almost an hour or little more. Thank you so much indeed. Namaskar.
Great.
It was indeed a great pleasure on my part. Thank you so much for this opportunity, and a greatest happiness to see you, Dr. Ashok Chauhan, and your entire family. I think Amity is your extended family, so I include all of them in that thought. And I think our greatest satisfaction is from the renewed friendship of our families and the great success of your institution, because through that you are strengthening the country and the world as your students go out as proud representatives of this value system and help the economy of our country. All the very best to each one of you. Namaste and thank you.
Thank you so much indeed. We are very proud of you. We are very proud of Apollo and of course very proud of FICCI.
Thank you very much.
Great leadership.
Thank you.
Nation like ours.
Yes.
Thank you so much once again.